Welcome to COVID Conversations on the 24th of April. Today I'm talking to Scott Preston, who is a GP and clinician, and Patrice Cafferkey, who is a practice manager and owner and a registered nurse. We're talking about some of the stressful challenges of practicing in this unprecedented time and some of the things that you can do about it.
From my perspective, over 20 years managing a large general practice, I've never experienced anything like it in my life. My support staff are slammed. They have had such a hard time. The level of vulnerability that the patients are showing us, I have 8 phone lines in that are jammed all day long. It's taking staff 4 minutes to make an appointment to get the patient through the anxiety of coming in to have their proper medicine delivered to them face to face. My nurses are amazing, and they are amazing supporting the doctors. I'm hearing this from all of my friends all around Australia, that the administration side of things has just become so difficult and so complex, and all I feel I can do to support the staff is be there for them and with them and give them all the tools that they need to get through their job.
The important thing with the management of any mental health conditions, and that mental health condition can just be stress alone, is that you not just approach it from one perspective. You need to approach it from many different perspectives. You know, that can be in the form of counselling, it can be in the form of exercise, you know, it can be activity scheduling, problem solving, making sure that you maintain your social networks. I think the Access EAP program that's being proposed by the PHN is really important for providing that counselling option. And I think the key here is that it's private. Privacy is absolutely critical, not only to GPs and GP registrars, but also to the other staff. And let's not forget the pharmacists and the allied health professionals, you know, the front desk staff, the nurses within practices.
I think it's really important that everyone knows it's okay to show your vulnerabilities and to ask for help. And I think the great thing about this program is I don't need to know that my staff have asked for help. They can do it confidentially for whatever reason that they feel that they need to, and I will continue push that, offering with my team so that they know if they've got something that they need help with for their wellbeing, that they can do that, and I don't have to be a part of that conversation. That's their private business.
It can be, you know, an exacerbation of your pre-existing anxiety or depression. It can be gambling disorders. It can be, you know, alcohol and drug problems. It can just be that you feel a little bit stressed and you want to talk to someone. And I would highly recommend anyone that feels that they fall into these groups that they utilise these services, because I think it's particularly generous on behalf of the Brisbane South PHN that this is provided.
I think it's really important for people to recognise the domestic situation at home as well as being something very unique, and people will be suffering from increased domestic violence episodes, or, you know, unhappiness in the home, whether it be because you're stuck with your children all day long, or your partner's lost his job or her job. I think that's a really, really important thing to let people know, that it's okay to ask for help in those situations as well. Even if they are coping in the workplace, they might not be so lucky in their home. And I reiterate, it's safe and it's private and it's confidential. And hats off to all of the staff working in general practice at the moment, because we will get through it to the other side, and the patients and our, what if you want to call them patients or clients, are so very appreciative that they can still get their needed care in a safe environment, and an environment where they feel safe to come into and they feel safe to be cared for, and I think that's really important for everyone to recognise in general practice as well. It's been tough.
Thank you both. Incredible of you to come and talk to me today, and I agree that these practitioners, these teams are doing brilliant work in really, really difficult circumstances, and we wish them all the best. So thank you very much.
Thank you.
Thanks for having us.
And thank you. We'll see you next time.